endeavor. In this session, we will be delving into key aspects of research planning, including how to carefully select the study population, manage projects effectively, design effective data collection tools, and gain a broad understanding of data analysis methods. These components form the backbone of any successful research project and are essential for generating reliable and meaningful results. To lead us through this discussion, we are privileged to have Dr. Girdhara Gopal. He is a medical doctor with advanced training in infectious disease epidemiology and health economics from AIMS New Delhi. He currently serves as the lead for monitoring and evaluation at the Clinton Health Access Initiative. With a deep commitment to evidence based decision making, Dr. Gopal emphasizes the importance of high quality data in disease programs and research. His work focuses on developing data driven solutions using cloud based automation technologies. Core member of the backend team that created the global COVID-19 access tracker, which enabled real time data collection, cleaning, and analysis from 234 members states using scalable cloud-based pipelines. Dr. Gopal has also contributed his expertise as a consultant to global health organizations, including WHO headquarters, WHO Zero, JPIGO, and several others. Outside of work, he is passionate about exploring technical innovation in digital health and spends his free time reading new code and experimenting with emerging technologies. Without further ado, please join me in welcoming Dr. Girdhara Gopal.
Yeah, hi. Thank you so much for the introduction. Actually, it's been a great privilege for me to come here. I've not been part of the academic training for quite a long time. I've been practicing into research, but I'm not into the academia. So it's been a while for me that I've actually been in a forum wherein I was asked to teach someone. So thank you for giving this opportunity. But before I dive into my slides, I just want to build a context as to how I'm approaching this. So one of the team members from your research society came forward and asked me to create a slide deck. So I was very kind of thinking whether this should be too much of research, or I need to balance it because I wanted to be sure that as target audiences, I don't want to bore anyone. Because I know the background from you guys come from. Most of you are in MBBS, some I think in internship, and some are probably in the process of preparing for your NEET PG exams, right? So while yes, I will be definitely diving into the higher and broad elements of research, I thought I would position my speak, or rather my speech, more on samples and how do you go about the sampling strategy, because you could be in public health, you could be in clinical health, you could be in non-clinical practice, anywhere. Any research will definitely require it. And how would you look at research and why you want to do that? That sampling methodology is going to be the same, right? So that's a fundamental for everywhere. In terms of project management, I would just probably superficially touch into some concepts as to, what are the things as a researcher you would come across. But only until you guys really be part of a research study or you go through it will is when you understand about it. I will just very quickly go through some sample data sets that I have towards the end. And I'll just mention about, some tests of significance, like how do you go about, chi-square or t-test and all those kind of things. So as I said, 80-90% of my time would be going into sampling methods. So I'll just get on with my slide. Um, just a sec. Is my slides visible?
Yes, sir.
Okay, thank you. So let me start, right? Um, the overall, why do we need to do research? I mean, research sounds like a very fancy term, right? I mean, we think, okay, it's just papers, you do reading, you do, some data collection here and there, and then you publish it, and then you get some impact factors. You get to become a researcher. But Research is much beyond that, because as science evolves, whether it be a drug, whether it be a vaccine, whether it be a clinical therapy, whether it be a surgical therapy, whether it be a community based intervention, whether it be any high level programmatic intervention that you have the WHOs and all doing it, fundamentally as humans we need to know whether it is useful, should we invest in it, and last but not the least, what kind of impact are all these things really going to translate into if this kind of work is going to happen? Now, to get into these questions, I'm sure most of you would be probably planning to become radiologists or pediatricians or maybe into, cardiologists and all. I was of that thought process before I joined community medicine. But then when I joined into this branch, I realized, as researchers, let's keep community medicine aside, as researchers, it is a duty for all clinicians to understand what we prescribe and what we do is scientific, is evidence based, and it's also something that we add more knowledge to the clinical or the doctor community or to the global community. Now, the first step in any research process is first you identify, okay, what is the problem that we are trying to understand? I mean, it could be a disease that we are trying to treat, or it could be a disease that we are trying to prevent by a vaccination, or a disease that we want to identify and screen earlier. It could be cancer cervix, it could be diabetes, it could be hypertension. So, what kind of problems do we have? And then you need to define that problem. Yes, we don't have a specific estimate of the disease. We don't have a necessary tool, like, for example, maybe when I was in my MBBS days, it was more on just fasting blood sugar, and HBP and A1C just came, at that point in time. Now, HbA1c has become very, very famous when it comes to screening for diabetes. But then, are all these tests sensitive? Are all these tests specific? What is a positive predictive value? What's a negative predictive value? So, you need to be very clear as a clinician when even when you work. Please start asking questions. Why you do what you're doing, whether what you're doing is correct, is it always going to work, and what it is going to translate to the patients. Once you are clear of identifying the specific question that you want to do research with, then comes the preliminary research. Usually as researchers, what we do is we tend to see, okay, is it just me who has done this research, or I have this idea to conduct this research problem, or is there anyone else in the globe who is doing it? So you could go into Google, you could go into PubMed, you could do some kind of research there, identify whether there's something similar being thought of. If not, then great, you're probably thinking like Einstein and you could start your own research proposal. Then comes formulating a hypothesis, and then comes designing the research. I mean, I was told that you guys were already covered, aspects of study designs, so on and so forth. So when you create evidences, there is usually a complete spectrum of designs, right? A very basic design is your cross-sectional study. Then comes some association studies wherein you have case control and cohort studies. The most gold standard is your RCTs, right? And then finally comes when you define the research as you're collecting the data. There are some elements in it, and that's where I'm going to focus more. So my focus today would be 85% on collecting data. Analyzing, interpreting data, I'm just going to touch a bit, but maybe if I get the opportunity to meet you guys and train later on, I'm more than happy to dive deeper into statistical softwares and some visualization tools that we use in research, so that how do you analyze and what do you interpret from it, I'll be more than happy to explain there. So that interpretation is where you will look into the relative risks, the odds ratios, the regression models, the costing, the cost effectiveness, and then what do you mean by prevalence, incidence ratio, etc., so on and so forth. So yes, you will have to be very sure that not all your study designs can give a specific estimate. But if you're sure that I want to do a prevalence, you will do a cross-sectional study. If I want a relative risk, you will do a cohort study. If you want to have a population attributable risk, you will do a population level cohort study, so on and so forth. Last but not the least is your conclusion report findings. I don't really want to spend some time there. If you have been able to master everything from step 1 to step 6, all that step 7 requires is just clear documentation, nil plagiarism. You use reference managers, and you have got a lot of AI tools, which I'll be discussing as I move forward to help you understand all these. So as I said, in my approach today, I'm not going to dwell more on step one, two, three, four. I'm going directly into five because I was told that you guys have been already taught about research study methodologies and study designs. Now, let's understand a fundamental concept of samples and data collection, right? When we're given a research, okay, now you have a question in your mind. Let me ask, if I were to look into a disease, let's say COVID-19, I'm sure that was the most, impactful, or rather the most game-changing issue that happened in our lifetimes. So if I have to ask a question, hey, how many people in the community right now are having COVID-19? Strange. Okay, now yes, we could do testing, we could go how to house and do contact tracing, we could do some numbers, etc., etc., etc. But the question would be, do I have to do this by, let's say in a country like India, wherein we have 150 crore people approximately, is it feasible to send all OSHA workers and ANMs and, your healthcare workers or program managers sitting in the state health departments to collect it? Not, because it's not cost effective. So that's where you then come to a question of having a sample. You choose a very specific set of geographies or specific set of populations, and you try to study what is the prevalence of COVID-19 using your test there. And then you do an extrapolation to say that, okay, I did some sample tests in, say, 5,000, 6,000 people in the state of Madhya Pradesh. Now, my assumption says that, yes, in the 6,000 people, I found 600 to be positive for COVID-19 when I visited. So, possibly, Madhya Pradesh is having 10% prevalence. Then the question comes, okay, is it 10% real truth, or could there be any confidence issues? So that's where your sampling and your confidence intervals and all come, because if you do a convenience sample, it is not representative, right? I mean, you can just go any house and pick it up and then say, hey, you know what, I interviewed 2,000, 3,000 people and my result is saying 10%. That is very weak. But if your sampling methodology is representative of the final population, so I would say that, okay, Madhya Pradesh has got a population of 5 crores, and now I did a really good sample size estimation. It is not a 5,000 sample size estimation, but rather it is 50,000. And I chose this 50,000 very, very critically by district, by blocks, by villages, by cities, by towns. And then, given the kind of population density and the kind of population diversity by, upper, middle, lower class, rich, poor, middle class, or, rural, urban, or, tier one, tier two, tier three cities, good, bad, poor education, etc., etc. I have a representative sample of 50,000, and that says the prevalence is 10%. Yes, then the truth is, yes, you probably have been able to come closer to the final, estimation of COVID-19. So that is the reason why a sample is not always very easy. It has to be intensively thought through. And that is where, when you read research journals or any paper, I mean, I'm not speaking anything on the perspective of public health, but even if you go to clinical health, you do any studies or you read papers on radiology, pathology, you will have to define what is your sample. And that is usually written in the inclusion criteria and exclusion criteria, right? Now, what is a sampling? As I told, a sample is a part of a larger body. It's specially selected to represent the whole, right? That representation of the whole universe that is there is very important. If it is not representative, then whatever you do, the hi-fi AI models you do, the hi-fi analysis you do, it's not going to be the truth, because your sample was very vague. So the result is going to be vague. Just imagine like garbage in, garbage out, right? But if your sample is great and you know that, okay, what are the pros and cons of your sample, what were the necessary thoughts that you had taken before selecting the sample, then you will be more confident to tell about the final result. Sampling is taken any portion of a population or universe as representative of that population or universe. Sampling is the process by which this part is chosen. So basically, to arrive at a sample, you do a sampling process, right? Now, okay. So this is the entire thing that I just told little while earlier. You could just see pictorially. So the theoretical population I want to generalize my result to is USA. Okay. So what population can you get access to? Is it possible for you to reach out to all sections of the community? By race, by region, by education, by wealth quintiles, by social class, by behavioral issues, by access to healthcare. I mean, there are a lot of variables. So, on this basis, are you going to get access to all that population? And that is actually going to be your study population. And then you also need to be very sure that although you theoretically feel, yes, I'll be able to reach out to them, there'll be some people who may not be ready to answer you because you can't force anyone to join into research. If it is RCT and all this, intervention studies, that's even more difficult. People then think that, hey, you're trying to give us vaccines, you're trying to give us drugs, and then there is a whole body of, resistance to it. Yes, of course, human ethics is there. So you need to be very cautious about how we are going to reach out to them. So that's where the sampling frame and the sampling methodology comes. And then the final people who then come out of this entire activity is your study sample. Now, why do you need to draw a sample? You can say, hey, Dr. Giri, you know what? We can just go, we can just do all telegrams and WhatsApps and, we could send emails, etc. My question to you is, will that be good? Or how much coverage would you be able to achieve? How much right response you will be able to achieve? Whether the person was able to understand the questions better had it been sent over Telegram, WhatsApp, and all these kind of, funky technology innovations, or should you be in person so that you explain the research, you explain the question so that the person understands it and then gives you response, right? So usually, the reason is you can't go to all the houses, and that's the reason why we do this because it's less time consuming. You don't have to go all the houses, as I said. It's less costly because, mind you, to hire a person to conduct a research, let's say, even if you want to have a questionnaire that has 15 questions, and let's say you will be filling it in 15 minutes, assuming the individual will be filling like 3 forms per hour, and for 8 hours, the person will be filling 25 questions. So that individual for a month would easily charge anywhere between 25,000 to 30,000. And of course, I mean, any activity, we have to pay for the labor and for the work that they do. And of course, there is an element of data quality. There's an element of whether the person understands what you do, whether the person goes to the people whom we have asked them to do, and all those kind of things. So these are like things that you need to be a little cautious. Yes, we by doing a sample, we ensure that we do it in less time, we do it in less cost, and it's less cumbersome and practical to do this kind of activity. But is it still foolproof? No, absolutely not. There is also elements of, your monitoring and evaluation, because some people are people. We are not robots. People are destined and tuned to be doing mischievous work. Some just fill the data for the sake of it, and that's where you have seen in most of the programs and all that some programs report good data, some programs don't report good data, and if they don't, it's very hard to find whether all the investments and all the work that is happening well or not, right? So this is some very high level definition. We probably tend to use few words interchangeably, but let me just clear. Population is the final universe, right? And it's the everything that under which we want to study. From the population, we are taking a portion which is your sample, and that is the target to whom we will give our questionnaire. We will be, filling it in any Excel sheet or Google sheet or Kobo, so on and so forth. I will not be getting into it, but as I told, I'll just give you the processes. So from the sample, we'll be collecting the data. Now, people might ask, Dr. Giri, parameters and statistics both sound the same, but they are not. They're both numbers though, but parameter is something that you speak at a population level. So, for example, what is the average height of Indians? That is a statistic. But what is the average life expectancy of, let's say, all the Indians in the country? Let's say you're not using a sample there. You have the entire database of Indians in Aadhaar card, right from their date of birth, right till their date of death. And from there, if you're able to calculate the life expectancy, that becomes a parameter. So basically, if you are able to describe something in a population entirety, that is a parameter. So be very careful when you use between statistic and parameters. Both are the same, but statistic is usually in a sample, parameters are usually in a population. Just to, for completion sake, I'll just come with few slides here and there to give what census is and what research studies are. Now, census is something wherein all the members of a population are covered. Now, rightly so, that is why in the country of India, I mean, yes, we used to do it every decade, but yes, since 2011, we don't have any update on our population numbers. Probably the next year they're planning to do it. So this is a house-to-house activity. All the 150 crore people would be covered, and then some basic variables on sex, gender, occupation, education, residence, and I think some elements of some disease burden is also planned this time, so I'm not entirely sure about it. But the idea is, you do it in all houses, right? And then there is also something called a Gallup poll. This is something very funky and used across Western countries. What they do is, they just have, it's pretty similar to how you have the exit polls in election time. So something like this, they will choose some random households and random pin codes. And that's possible in Western countries because they have the complete list of houses and, individuals by name in their population registry. So from there, they will choose some 1,500 people and try to understand, most common people's opinions and knowledge and what they feel, what they don't feel, right, etc., etc. And usually the sample size, if you see here, it allows, the kind of results that we arrive from these approaches is actually, we are confident 95% because we hardly miss people. And the confidence interval will be super narrow, and then you will be accurate by just plus or minus 3%, right? That's the kind of what do you call, precision that you would be able to achieve from a census like activity. Now, there are some terminologies I want to go. While I have addressed at a population level, you have a census, you have a Gallup polls or a election poll, and all those kind of things which have high precision, high confidence issues. Now I'm coming down into the sampling concepts and terminologies which we use for samples, right? Now here you have three things, right? As I earlier mentioned, you have a population or a target population in which you need to identify the sample. Then comes your sampling unit, and then comes the sampling frame. So you will ask, hey, what is this sampling unit and what is this sampling frame? So the question would be, now if I look at it from a very high level, sitting from Delhi, and I plan a study on, I'll just give an example, a mental health survey. And that activity is actually happening across all the states right now. And I think the sample size is probably around 80,000, 90,000 people in the entire country. So okay, now I want to understand the prevalence of mental health issues in adolescents, in adults, and in elderly people. Now, that is my research question. But as I drill down, I need to arrive at a sample size estimation. Okay, I was able to arrive that I would need 15,000 adolescents, 35,000 adults, 30 odd thousand in elderly people. Okay, then comes the question, how will I be able to do in all the states? Then you will be applying weights, and then you will be trying to say, okay, so much proportion will come from Uttar Pradesh, so much will come from Sikkim, so much would come from Leh Ladakh, so much would come from Himachal Pradesh, so on and so forth. Then you come down, okay, do I take all the districts within a state? Maybe, maybe not. But then there comes an element of random district choice. And then within a district comes, okay, do I choose all the blocks? No, maybe, maybe not. Again comes an element of random sampling for blocks. Then comes your, okay, within a block, do I take all the towns and villages? Maybe, maybe not. Then comes you choose a random set of villages and towns. And within the towns you come, the villages you come, you'll say, do I take all the households? Do I take all the, huts and, hamlets that we have in that locality? So your sampling unit defines whether you want to do it at the level of the household, you want to do it at the level of the individual, so on and so forth. And a sampling frame is usually, we don't have a great sampling frame in India, primarily because we don't track people. But sampling frames are very useful in Western countries because you will be able to have a map, you will be able to have, how many houses are there, how many households are there within each household, how many individuals are there, and all that. But in the absence of that kind of information, a sampling frame is usually not possible in a country like India. Maybe in gated communities, maybe in hospitals, maybe in certain cities like Chandigarh, or well planned places wherein you have a good population repository, right? Okay. Now, what is this population or target population? So it is a collection of all individuals, families, groups, organizations, or events that we're interested in finding about. And is a population to which the researcher would like to generalize the results? Usually, yes, we have to do that. And that's the reason why I was telling very clearly, if you want to generalize the result that you're carrying out in the research, your target population and the population has to be defined. For a very simple example, if I have to study the effect of smoking on lung cancer, there is no reason for me to go and approach non-smokers. I will have to make it very specific that my starting point is people who are smoking. But yes, if I have to understand the effect of smoking on lung cancer, then I would also need to have a control group. So I will have some proportion of people in my sample to follow up and understand among non-smokers how many would or would not develop lung cancer. So it's very clear, right? So your again, if I have to ask a question on let's say contraceptive use, on OCPs, etc., etc., I don't have any, reason to go, to a person who is unmarried. Again, it's very unethical. It's not great. We are not such a modern society in India. But then we can define it in married couples. We can do all those kind of things. So that is where, the element of ethics comes, and that is where the element of including with whom in your study population, so that you are rest assured that the questions that you're going to ask, you will be able to elicit a response. If you're very sure that you just go random and you ask anybody and you will try to get a response, then your target population is pretty weak, right? Now, sampling unit, element unit, or analysis, right? So um usually it is the basis at which we want to do. So as I said, it could be a individual, and you can also make it even more granular. Is it an individual male, female, or other genders? Because right now LGBTQ spectrum is also people whom we have to respect and whom we have to be considerate of when it comes to research studies. It was not the case so maybe like 10-15 years back when it started, but now it's been taken into consideration. So yes, that's there. Or are you looking at specifically age group under 5, teenagers, college going students, adults, married couples, or let's say elderly people age 65 above, so on and so forth. And as I said, probably like a slide or two earlier, it could also be a household. So you could just ask, okay, in how many of these households was there a history of injury? Yeah, you could do that because the extent of injury as an issue if you feel injury is going to contribute to more out of pocket expenses. So at that point in time, there is no point going all the way down to each individual in a locality. You can just probably say, yes, this is a rural community, let's say in Bihar or in Northeast India or in South India. And in this rural community, there were 500 households that we had randomly chosen. And in that 500, we found 30% of households had a history of injury, any injury, it could be any age group. And then you could say, in rural communities, in rural households, this is the average out of pocket expenditure. Yeah, yes, absolutely. That's a very useful statistic that we could give for policymakers. Sampling frame. So this sampling frame, as I told earlier, it's not very great in India. Ideally, you should have the list of all individuals, all households, and everyone listed, and that is a sampling frame. But as I said, if it is a gated community, if it's a admitted hospital at a point in time, or let's say it's a school, which class, which student sitting where, a college, it's easier. But otherwise, mostly if you go to a village, I'm dead sure you won't have door numbers. Although, yes, we have in principle, but there is no directory that keeps track of, okay, now this place, this individual resides here. It is well monitored in Western countries. In cities where you have lot of tenants, lot of migration, immigration, etc., etc., it's very hard to do that. So it is just a list of the target people, right? Now, here comes the important thing of our discussion. I think I took a lot of time to come to this slide. Okay, took half an hour. Great. So sample design is basically how are you going to get to the target sample to achieve your envisioned research question, and you're confident that you're going to get the questions answered, right? So there is a steps that you have to do. In fact, over the previous few slides, I've actually told all the steps as I spoke. So what we actually do is we have to give some rules and procedures that how we are going to select. The first thing, as I told, was the inclusion exclusion criteria. So you will clearly define who is going to be part of your study, who is not going to be part of your study. And then basis which, how are you going to select them? So that is where there is something called a probability or a non-probability based sample design. Probability means it's random, meaning everyone has an equal chance to be part of the sample. Everyone, again, who qualify into the inclusion criteria. If you have excluded somebody, great. Non-probability means, hey, you know what, Dr. Giri, it's so complex. I don't want to get into all these random numbers and all this systematic random. It's so complicated. I'm really wondering how long it took to, make the sample size calculations for the NMHS or the National Mental Health Survey. You just said it's so complex. It's not my cup of tea. Fine, go for non-probability then. But then you don't have to say that I did a great research which is generalizable, right? So research is painful, but if you get into it and you like the dynamics of it, you will enjoy it. But is non-probability always not done? The answer is probably no. I could give you some examples. Let's say you have contact tracing in very, very niche, stigma-prone diseases. For example, intravenous drug use, sexually transmitted infections, HIV. I mean, yes, HIV is part of STIs, right? Um, you also have some kind of social pathway things like, okay, how does an information percolate into the community? Something that is wrong, right? I mean, people are always having good information and bad information, but then there are some pathways wherein bad information reaches. When you do research, you have to go through non-probability at times, wherein when you speak from one individual, you could go to the other individual because usually it is peers. And from that peer, you will probably add on more people as you go forward. So as I said, in STIs, it will be mostly clients and customers and people that, the person has having sexual contact with. Or in terms of, as I said, the poor information that I mentioned earlier, it could be, okay, it could be my school, it could be, the tuitions I go to, or my social peer groups I go and meet. And in terms of intravenous drug abusers, yes, it's a very close knit community. So you identify one, rest assured within the next 7 days, 10 days, you could be able to do it, but it's not always easy. Now, research in such communities is not very easy, primarily because although you do things in an ethical manner to help them, it comes with the complex issues of, okay, you will get caught with all the drug mafias, or with some big corrupt individual who is going to probably rob you of your money, and they'll question you, they'll burn your research studies and all that. In India, currently, in fact, the injectable drug abusers is still in a very, very nascent area, primarily because, it's very shoddy and very gray area there to enter. But yes, research in STIs and HIV is still pretty active, and I'm so happy to say that how India was probably way back in 2005, we are way much more better when it comes to, doing research in these individuals with STIs and HIV infections. So the sample size, finally, I'll come there. I think for you guys at this stage, 4 PQ by D square is more than important. So as I said, I would again just keep my discussion only from the 2 points here, or rather even more, only on probability, non-probability for sampling. There are some errors that usually happen, that we need to be careful of. The reason why I'm saying here is, oh yes, Dr. Giri, you know what? I'm so good. I do very good research. I do very good literature review. I ensure that all the hypothesis is made well. I made a great study design. I ensured that the inclusion exclusion criteria is there. I made a good sample size. I did a good sampling strategy. I also built a very great tool for ODK, Kobo collect, etc., etc. I'm very well prepared. No, I'm sorry. I mean, you're probably missing the very important piece of the entire puzzle. The moment you go down and the moment you go and start interacting with the target population, lot of errors that would happen. Usually, what happens is, let's say, I'll again come back to the error of that we are commonly facing in the National Mental Health Survey, right? And again, it's being led by the NIMHANS folks. NIMHANS was, like how I just gave an example, right? Yes, we are very perfect. It's so great. We have a lot of great researchers globally who are contributing to the proposal. Yes, it's going to be a great estimate. Okay, great. But the moment, it came all the way down, they made all the tools and everything. As I said, the issue of whether the people whom you're training are able to deliver and get into the sampling frame properly. No, there is no proper monitoring evaluation. Again, in terms of that's where we need to be very careful whether the interviewers are trained well. Very simple thing. Now, India is so diverse that I make a study questionnaire, yes, but then it has to be translated in Hindi, Marathi, Kannada, Tamil, Telugu. God knows what all languages that all these samples had to be questioned for. Second, although yes, we'll be able to identify interviews in this language to question the people, are they asking the right questions from start to finish, or are they just jumbling up words? I'll give a very simple question. So the questionnaire says, did you have fever in the last 1 week? Did you have any signs of feeling demotivated in the last 1 month? Okay. Now let's say an interviewer goes to a home and he asks the question, hello, namaste, how are you? Do you have fever? Oh, नहीं 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 कुछ नहीं. Oh no. क्या आपका मूड ठीक है? हाँ बिल्कुल बढ़िया है. हाँ yes yes great great. So, yes, the interviewer has asked the question, but is it the right question? Maybe not. So, this is something that usually is a very big problem that happens in research. What you write is not what the interviewer asks, and what the interviewer asks is usually not the respondent needs to respond. So that is the interviewer and respondent issue. Then comes your instrument. Instrument, I would rather say these days it's been nullified a bit because earlier people used to write it in papers. Now that has actually reduced because of the use of good digital tools. You really have applications, tablets. It's become very hi-fi. All you need is just 4G, 5G connection. You open this Kobo module, this module, that module. You fill it up and you just submit it. It directly goes to some server and then you can populate all the responses and see in an Excel file. And then the method, as I said, it's become more this thing. But in again, as I said, everything has its own pros and cons. Yes, I do believe in person is the best. But even in person, if you are not cognizant of the interviewer issues and respondent issues, it's still a weak. Yes, then you may say, sir, then I will send it all across Facebook. I will do this, I will do that. Sorry, then your representation was going to be a question, and how that person really replied and understood the questions you will not know. So yes, you will have all these errors. Then there is also errors of your non-observation. Now these are things that happen when, because over the course of your research, what happens is you plan to do a research with a certain methodology. Yes, you said I will do a cross-sectional study, case control, cohort, etc., 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 in a specific sample to arrive at a specific estimate. But what happens is, again, if I have to take the same example of the mental health survey, again, don't take me wrong. And, probably one of you guys should not go to an enhanced researcher and say that, hey, Dr. Giri was speaking about it. But I'm just giving an example because, these things were thought through and, the estimates are coming up well. So what would happen is when the sampling itself is wrong, you're probably deviating a bit from the final estimate. So maybe your sample was more biased. You took people who are having issues. You took people who had more fever. You took people who had lot of mental health problem. And then artificially, your sample will say 60, 70, 80% of people are having mental health issues or fever in the last 1 month. But if you went on to have really good sampling methodology, you are able to map, the person, whether it is like concentrated in a geography or it is well spread out in the entire state, you are less assured that, okay, yes, my sample is very well taken care of, right? So usually what we do to alleviate this is like we build lat long coordinates in the questionnaire. So at the time of filling the question, we get to see where the respondent and the interviewer is at that point in time. And once the question is, submitted into the server, we usually see that, okay, now it's not a very, concentrated set of respondents. This respondent is here. The next respondent is probably, let's say, 5, 6 households. And then you'll try to see a beautiful distribution of respondents. I will not show you here, but I'm just giving you a theory on how, we researchers approach this problem. And then, as I said little while earlier, and the sampling frame does not matches perfectly with the target population. So errors of coverage. So for example, if I have to tell a very recent issue, so there was this request from the Ministry of Health wherein they wanted to reach to children who never got vaccinated. Hey, Dr. Giri, are you sure such issues happen in a country like India? Absolutely, yes. So you have to go to the farthest tribal corners and the most poorest sections of the community to witness that. So the question is, what is the burden of such children? So to answer that question, I cannot do it in a city like Delhi, Bombay, Kolkata, etc. Maybe yes, I can do it in slums, but I would rather say, even in cities, we have a better, coverage of immunization program. But when you go to the rural side and the farthest to farther sections in the tribal districts, etc., you need to create a sampling frame that is able to capture such people who don't come out of their houses, people who are marginalized primarily because of, local communal issues, caste. In states like Chhattisgarh, Jharkhand, you have the issues of Naxalites and all that. So it's very challenging, right? And that's one reason why healthcare does not reach to them. So do you really have research that is able to reach to such people and understand whether you're able to understand why they're not getting vaccinated? So that's where the question of coverage comes. How well is your sampling frame and your entire sampling strategy so that you're able to address all the sections of the people to get the estimate that you want to arrive at? Then this is basically, the other non-response issues. Usually what happens is, the people, they are not educated to understand the question. They may just shy away, or there could be some political, social, religious, cultural reasons they don't want to answer. For very simple reason, if you go down to the community and ask questions on abortions and STIs, guaranteed your response rate would be just 5-10%, or people would probably faking their responses just to say, hey, I'm a good person. But more or less, you will not get the actual truth. People may refuse to answer. That's their choice. They want to give an answer, yes or no. And then you are not able to contact some people. Usually, what happens, when you go in some places, again, in very huge hilly terrains, or, in winters when you go to like all snow terrains, people don't reside there, but you have to collect one or two samples, right? So what we then do is we wait for a month or two until all the snow settles, the roads open up, and then you have floods, right? So floods may happen suddenly, so you have to totally keep an area separate, and then you plan the data collection after the flood subsides and people start to come back living there, right? So these are some areas of non-observation. Now, again, I don't want to spend time much here, but I have already told some very characteristics of how these issues can be minimized. Interviews have direct and dramatic effect, and then most people tend to side with the view apparently favored by the interviewer. Now, if the interviewer thinks something is good and keeps asking the question like that, people will think while responding that, hey, you know what, that guy is favoring that kind of response. Let me give that response. For instance, is COVID-19 a good vaccine? Okay. For a survey wherein I want to understand the vaccine hesitancy of COVID-19 in the community. With due respect, let's say the person who is coming from COVID-19 research, that individual is totally against vaccines. So he will ask a question: do you want to have a COVID-19 vaccine? And the tone will say like as if he hates it, but he's asking the question primarily for his job and primarily for his salary. That person who is going to give a response, yeah, maybe, maybe not. Hey, COVID-19 is so bad. The vaccine is going to kill you, etc., etc. Now you tell me, would you like to take a vaccine? Hey, 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 no, 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 I don't want. So the person has actually been able to influence the response, right, at the time of interview. So that is not something that we would like to do. So that is the very critical skill of an interviewer. Then you need to be very neutral, you need to be very friendly so that you can build a rapport. So some interviewers people don't like, they will just tell, okay, you came, okay, haha, everything is great, get out. Some people are able to get good rapport. And I still remember during my AIMS days, during my residency, when we used to go to the community, people used to welcome us, people used to give us, all chocolates, sweets, and local foods and whatnot. I mean, we used to spend our morning to evenings in the community, sitting at huts and, sitting with all the old people and listening to the stories. So it used to be good fun, right? And then in general, interviews of the same gender, racial, ethnic groups are those being interviewed. So again, you need to be cognizant that, let's say you send to a tribal community some individual from a city. Maybe the city guy will not be able to relate easily to them. He'll probably speak more, hi-fi Hindi and, club some English terms in it. The poor tribal man will not be able to understand that. So you need to have people who are more closer to them, people they can relate with, so that you could get good responses. Respondents, again, they differ greatly because the motivation may be very different. They may not do so. And then, as I said, some sensitive questions, whether it is on STIs, abortions, and things that they feel it's a stigma, they may not be able to respond properly. There could be issues on recall because if you ask a question that is 2 years back, they may not be able to tell you. Prestige, primarily because, if you ask questions that are silly and there's, it probably positions them in a very lower grade. Like, hey, have you passed your 10th standard? Have you passed your school, etc., etc.? That's not a good way to ask. You should probably ask, okay,
I think there is a network issue. Sir will join shortly. Hello all, sir. Uh, Hello, sir will join in 2 minutes. It's take it a 2 minutes break. Rajvi, please unmute, sir. Rajvi,
Sir, it's not in my hand.
Abhishek.
Yeah, it's done.
Okay, sir, you can unmute now.
Okay, thank you, Dattatreya. Okay, so great. Am I still sharing my screen? Someone has put it on. Shall I start or how do we go, Dattatreya?
Yes, sir, you can start, sir.
Just a second. Um, okay. Uh, do you have to do anything on this? Let me minimize it. Okay. Okay, great. So much for digital age and digital media. So I think we have to bear with all the issues in Wi-Fi and power fluctuations. But anyway, yeah, that's good that we had a break in 45 minutes. But let me, try to just wrap it up, although I could see that I'm probably in slide 18. But yes, I think I have covered most of the things that I were being able to do. So it'll pretty much appear more or less like repetitive. I would spend more time on slides which I feel that would be very well required for you. So again, response rates is pretty much, it's more function of how good you are, how well your interviewers are able to elicit the response, and then comes the process, right? So yes, here you see, you define the population, you define a sampling frame, then you specify a sampling method, and then you determine the sample size, the sampling plan, and then you do the data collection, and then after you do the data collection after you do the data collection, you look whether whether your sampling has been great, and then whether your estimate from the data is correct or not. Types of sampling. So we spoke about probability, non-probability, right? So this is the one, probability, which is random, non-probability, non-random. Now this is the high level thing. Now again, at your level, you guys can just look at it. Probability is your simple random systematic stratified and cluster. So the example of what I gave in NMHS, National Mental Health Survey, wherein you start from a very high level and come down all the way to households and individuals, is a stratified multi-stage cluster sampling, pretty much used in National Family Health Surveys, state level surveys, etc., etc. Simple random is very, just like, okay, every individual in a target community, it could be a hospital, it could be a school, they would have an equal chance of being part of your sample. Systematic is you have a sampling interval in post question, you have the final sampling frame that you have. For instance, let's say you have 1,000 individuals, right? And you have to take 200 from that specific 1,000 individuals. So what is 1,000 divided by 200? 5. So what you need to do in your first 0, 1, 2, 3, 4, 5, you choose a number randomly, and from there on, you just keep adding 5, which is 2, then 7, 12, 17, 22, 27, 32, 37. When you finish, you're going to arrive at 200 samples. That is the rationale behind systematic. Non-probability samples is convenience. As I said, okay, I just get into a clinic. I interview the first 10 people who come to the clinic. I'm just trying to understand the knowledge, of the particular individual on a disease, etc., etc. I mean, you just do it out of convenience, right? So that's convenience. Quota is a little different. Quota is you define, hey, in my sample, I will choose 50% males, 50% females. Then you also say, among the 50% males, I will choose 25%, sorry, 50% children, 50% adults. Among the females, again, 50% children, 50% adults. So you already define it. But usually quota sample is not representative, but it is usually carried out in a very quick manner. Primarily, you just say that, hey, you know what, we want to ensure that we have all age groups, we have all gender, you have all necessary characteristics addressed in the final sample. So let's go with a quota. Snowball is what I told in the example of HIV and STIs. So you start from 1, and from there you move to 2. From 2 you get 3 more, from 3 you get 4 more, like that you keep just growing down, right? So that is all about it. Very quickly, let's get into the probability sampling. So as I said, this is one in which each person in the population has a chance or probability of being selected. You have simple, random, systematic, stratified, and cluster. I've already gave you great examples as I spoke. Unless you guys were watching IPL or you were probably having your dinner, I don't have a problem. But if you have listened to it, then it's simple, random, systematic, stratified, and cluster. And then this is the overall thing that I said, right? So simple random sample, every individual or item has an equal chance. Selection may be with, without replacement. With replacement, without replacement is usually like this. Let's say you have 100 people and you want to choose, let's say 40 random individuals from the final sample. So you choose randomly, say 42, okay? Now you removed 42. How many people are still remaining? It is 99. So earlier the chance of getting selected was 1 in 100. Now after one person was selected, the chance of getting selected is 1 in 99. Now then the question is, okay, do you put the same individual back into the sampling frame? Some studies do that. I don't want it to get into it right now. It'll be too much for you at this level in time. If you replace the same individual back into the sampling frame, it is replacement. If you remove him or her from the sampling frame, then your probability of selection keeps increasing. So it will become from 1 in 100, it will become 1 in 99, 1 in 98, 1 in 97, 1 in 96. It keeps reducing until you achieve your sample size. But if you keep replacing, it will always remain 1 in 100. When and where they use it, I think it is beyond your scope. Usually, if I had to give an example, it's like kind of you want to do some kind of popular polls, right? So you have individuals who you want to choose. So you choose 200 at once, and then you take your popular poll, but then you put the same individual back again. You interview them after 2 3 days because you want to understand whether the people are responding differently. You don't want to choose the poll from the remaining 80. So it's usually used in very regular intersections of, okay, today I want to check what is the popular opinion. So you choose 200 and then you put the 200 people again. So it is possible that the same individual may be interviewed more than once. So that is the issue with it. And then again, how it is done, it's used with random numbers and random generators, etc., etc. Again, you guys, once you get into the research office and research assistantship posts, or if you guys are planning to get into USMLE, you can dive deeper into it on how it's done. Systematic sample, I told you, this is by picking every 5th or 10th individual. Usually this, as I told you, I gave an example of 1,000 and final sample of 200. So you choose the first 5 random and then you keep adding 5, 5, 5. So that's about it. So the initial start would be random and then you have to skip systematically. Now here it is given 5th or 10th at regular, but that 5th or 10th is usually decided by your final sampling frame divided by the total sample size. So if it is 10,000 and you want to choose 200, so usually it is every 50th. So in the first 50, you choose somebody random and then you keep adding 50, 50, 50, 50, 50. That is the thought. Okay. Systematic sample, again, this is how they do it. So you choose, and then again, it's 3, 13, 23, 33, etc., so on and so forth. Stratified sample, again, you have multiple groups, and then you have, different layers of choosing it. So you see here, you have, it involves the population into distinct subgroups, as I said, age, socioeconomic status, religion, and then selecting a random number from each subgroup. So that, again, this is a very specific and a very funny example. African voodoo healers, I think I got this from some colleague of mine elsewhere. So I'm not entirely sure from where he got it. But in India, if I had to put it, let's say RMPs, okay? The RMPs who sit in quacks, who sit in your village level. So you could just probably think of doing a stratified random sample of that case. And then um, especially the issue with the stratified random, what happens is as you keep going from top to bottom, um, whether it is already being reported or not is a very important question. I'll tell you what you mean by reporting. So let's say LGBTQ, it's a very, 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 sensitive and a very, very, very uh, stigmatized issue and a concept. What if the people don't report it at all? So when I as a researcher want to ensure that my samples have males, females, and then people in the entire spectrum, I may not be able to do it unless I know that, okay, there is an estimate that says in India, in these cities or in these states, this is going to happen. So if you don't have that kind of a very small representation in the community, and because of stigma, it usually does not come out, which is fairly a fair point. So stratified random may not be able to do that. That's the missing element in it. And then you could also have these kind of stratifications on divided into two or more groups. Like you'd have males who are, let's say, 20 to 30 from the upper caste, males who are 30 to 40 who are from the lower caste. So you can actually club these kind of different characteristics and choose samples accordingly. Simple random sample is then selected from each group. So then that is the stratified random sample. Stratified sample, as I said, so you have different individuals and different characteristics, and then finally they will all come into place. So here it is a example wherein you have 30% male and 70% female. So to get a sample of 100 people, we randomly chose males from the population of all males and chose females, and then we ensured that we have this kind of a representation. Then the cluster sample, again, this is something which I told for the National Mental Health Survey, National Family Health Survey, and all the big surveys, wherein you start from the national level or from the state level. You drill down all the way down to the states, districts, cities, towns, wards, villages, towns, streets, households, even within households, ground floor, first floor, second floor, third floor. So you can do multiple cluster-based ways to do it. I'm not going to dive into it. I've already spoken, and this is how you do that. So you could get this kind of thing. So let me just probably get into few thoughts on the non-probability sampling. As I said, convenience is based on your convenience. Hey, I took the first 5 people, I took the last 5 people, I took the middle, people who came during the OPD hours, or let's say I found someone in the maybe let's say a follow-up clinic, and then I just chose those people who came to the laboratory for getting the sample, etc., etc. So that's, again, you define it very clearly. There's no inclusion exclusion criteria. It's just you need to say whom you did it. Purposive is, again, you have a purpose, you know that you will choose those people who do a certain element. So the purposive sampling, if I have to give an example, let me come there, then I could probably explain it, because I probably I could miss some points before the slide comes up. So again, man in the street surveys, you just go, you speak, and you get it done. So this is totally not generalizable. And then if you have a choice, don't use this method. That is a take home message, right? Quota, again, quota is a haphazard thing. As I said, you already, as mentally, you decide, hey, I'm going to have so many males, I'm going to have so many females, I'm going to have so many people from so many this, this caste, that caste, this class, lower class, this state, that state, rural, urban. You already determine in your sample that this is a proportion that I'm going to get. But that is usually not the way in the community. It could be very different. Maybe your community is 80% rural, 20% urban, 70% male, 30% female, maybe 60% educated, 40% uneducated. So if you go with a quota, it means that you really don't have given a thought on what's actually happening on the ground, right? No, this purpose is basically, it's something that you need to do wherein you have a judgment already in place. So you know that, okay, for this kind of question, I need to ask my interviews to only these select people in the target community. So you already know at the back of the mind, and that is guiding you to choose, the final target samples. So that is so, and usually it is done in experts. But then here, if I have to start and how to go about it, it is usually done in high level meetings wherein, let's say, I'll just give a thought, right? Let's say there is a pandemic preparedness treaty that's going to be coming. So WHO is releasing a questionnaire. Hey, what should be the chapters in the treaty? What all should be there in it? Who all should be part of it? And what all different elements should be covered in it, etc., etc. Right? So what they will do, they'll just internally they know, okay, now these 20, 30 experts are there. Let's reach out to them. Let's give this questionnaire and get their feedback. Does it mean that, okay, they've been able to get the right thing? No, but then it's based on some judgment, right? Okay, now these guys are experts, and okay, there's some high level expert who decided on these experts to be experts, and then they feel that, hey, these people are the right people to give the answer on what should be part of the treaty, etc., etc., right? So this is the snowball, and I think I covered little earlier. Examples of intravenous drug abuse. You have some social issues, social pathway changes, etc., etc. So these are kind of things that way you could understand how you could gather more people in your final sample size, right? So it's like recruiting based on recommendation, and you just keep going forward. That is the whole thought of it, right? Yeah, so non-sampling errors usually, again, that's the problem, right? I mean, you will not know when you will end it. The primarily when you have no sampling, you will not be sure, okay, should I end it at 10, when I should end it at 100. It will be very vague, so you will not be entirely confident whether your coverage is good, whether your estimate is good. That will not be a problem. Second is, you don't account for non-response, because you just randomly go, you question somebody, okay, that person did not respond, you go to the next fellow, okay, that fellow responded. But then scientifically you need to have a track. You know what, my sample size was 500. I went out to speak to 400 people. I already got 200 non-response, which means probably there is something wrong in me, or there is something wrong in the community, or there is something wrong in my questions. So that way you need to tackle it, and then ensure that your non-response is taken care of. And then the response errors, again, I told you a little while earlier, it's a good function of how good your interviewer is, how good you are if you're doing your own research in your masters or in your, your residency days, so on and so forth. Finally, this coding and data entry errors, I will come when I'm going to speak towards the end on monitoring and evaluation. And these are the errors that usually happen in surveys. I already had told you, you already excluded some people. I mean, again, it's again because not because you didn't think about it. Maybe the situations in which your work or your team does not go there and reach, as I said, floods, snowfall, roads are cut out. But then, do you totally exclude them? You may think, okay, I will do after 1, 2 months. But then there are some tricky people who may say, hey, you know what? We will just say that that area no one is already there, so let's just forget it. And then non-response error, so people may not give responses, so you need to follow up and ensure that you get the response. That can happen. Sampling error and measurement error. Measurement error, again, it's a very funny thing, right? So when you build a question, there is a huge science behind it. Again, I could speak on the validation reliability of a questionnaire for hours together, because when you build a questionnaire, it's very critical on what words are used. And when you build those questions into a meaningful sentences, you need to be sure whether 10 people I train to conduct an interview, they do the same thing. And when these 10 people go on to question 50 people individually, have all the 50 people being able to comprehend what I want to measure. So there's multiple levels of, you can't say complexity, It's multiple levels of things that you need to consider as a researcher, and measurement is a totally different topic. Now, I'm not sure what you guys have thought of when it comes to getting into it, but it's a very important thing when it comes to building tools for research, right? Improving response rates. So you reduce responses by prior notification, you motivate respondents, you give incentives. You could give the questionnaire to them and then you could explain them. You follow up with them, or you could try to, motivate them with probably people whom they believe. Usually, what we do in some villages is that, the people will not encourage you to enter their homes because of stigma, because of, they feel, hey, what you guys know about us. I'm not going to encourage you. At that point in time, you already take permissions from the local sarpanch, you speak with them, you go to the community, you say that, hey, you know what, this is the reason we want to come, we want to help you. And by doing this research, we can understand the problem and the burden of the problem, why the problem is happening, and then we can help you out. And then what will happen when we, the sarpanch guy will then have some kind of meetings, or, he will allow us to stick some posters across the village or that particular geography, and you get great access to do it. Reducing not at homes, usually what we will do, I mean, this is problem in cohort studies. So we start with 1,000 people. Mostly, as I said, some people would migrate out, some people would probably lock out and run away. You will not be able to trace them. So usually at the beginning of the study, what we do is we collect their phone numbers, and then we will say that, hey, if in case you are not at home, we will probably reach out to you over phone. Is that fine? So we'll take that consent and we will make them a call. So that way we could ensure that there is a good response and no loss to follow up. Survey worthiness. Okay, so here, usually as a researcher, this is something I don't. So this is a question that I ask every time. Have I done a great job? Right? Innately, as humans, we don't want to admit our mistakes. We always feel that, we are superhumans. We are the great. We are the best. And as medicos, we probably have it a notch higher than rest of the community. And let's admit it. We probably think we should not be questioned. We should not be, said that, hey, you're wrong. We should not be said that, hey, I did a mistake because, I'm the cream of the cream. I was a state topper. I was a school topper. I was the AIMS topper. I NEET topper, etc., etc. So when the question of evaluation comes for science, it is very important. You be from AIMS, you be from even the topmost institutes. You need to be sure whether what you have done is correct. So you need to keep asking to the basics. What is the purpose of the survey? Have I been able to address my research through that very well? Has the survey been based on a good probability sampling? Has there been any sampling issues? Has there been any coverage error? Has there been a problem in the appropriate sampling frame? What was the non-response issue? Have my teammates been able to question all the necessary responses? So that is a measurement error. Sampling error is always going to be there, but then you need to build ways around it. So I'll come to it when I'm going to speak on monitoring and evaluation, right? And then oversampling is also a problem. So this actually happens when you have the purposive sampling, right? So what happens is, or even in the stratified sampling, when you choose, uh, usually you tend to get more than what is required because you have the numbers, but then you can't tell those numbers to the community person. Now that person would probably go down and say, okay, sir, I will collect, 3, 4 males in this age group with this caste, 2, 3 males in this age group from that religion, 2, 3 females from this caste in that geography, etc., etc. But then only you will decide, right? So at times, what happens by the time the data comes to you will probably sit in your evening, you will have a cup of coffee, and then you will do a distribution check and see what is the proportion. You may land up oversampling, and that's okay. But in my opinion, if you actually had proper random sampling, you don't really have to worry about it. But this usually is a problem in stratified sampling strategies, right? And then yeah. So okay, so I'm not able to see what is here. Okay, so okay, I'm not able to see what's okay. This is okay here. Okay, so what sampling method do I recommend? So, um, or rather, if I have to ask a question, I mean, okay, this is a question for you guys. Maybe some of you could rather take it up. I see more people, or if you guys feel that, sir, this is too much of talking on a Friday night. I want to go watch IPL. I can skip this, slide altogether. So, what sampling method would you recommend? Determining a proportion of undernourished 5-year-olds in a village. So, what kind of sampling method would you do? Anyone wants to take it up, or do you want me to skip? I've gone through your age group, so I don't mind if you guys want me to skip. So please feel free. So I assume you don't want to have it, so I'll move forward. So sample size estimation, again, at your level, you guys could be more than happy to have 4 PQ by D square. Sample size relates to how many people to pick up. And the question often asked is how big a sample is necessary for a good survey. Usually, a good sample size is a function of how much money you have, how much precise you want to estimate, and where you're doing the study. So, all these factors will determine a good sample size. And then, as I said in the initial parts of my presentation, you need to have a good accuracy and good confidence in your estimate at a minimum cost. So, that is why you need a sample size. So, determination basically, I'll just give you a very simple thing. If you guys are interested, you could go to Lavanga, LWANGA. It's a sample size estimation book. Everything from start to finish is there. All it asks is, okay, if you want a specific estimate, you need to have some prior studies that you had referred to, and basis which you will then apply at a sample size. So it's kind of a logbook. I'm sure, I don't know whether these days you guys are being taught logarithm in school, but in that logarithm school, you have, that entire, uh, Montesa and that entire list of numbers, right? So similarly, you will have for each of this prevalences or each of this odds ratios and each of this relative risks and so much of your precision, what would be the adequate sample size. I don't believe in the online ones, because online ones don't show the calculators. But it's always preferable in science to go to manual and basics, because that's how you learn it. It's easy to say that AI tools are great. It's fun. Yes, I agree. Yes, it's fun. But it's also much easy to say that AI tools are not always great, because they are not great at times. Because when you understand the principles and the basics of how they operate, you will know most of the times you should not rely on them. And at least in science, you should, these kind of things, sample size estimation, some basic analysis, you should understand the principles. um Again, 4 PQ d square. Why it is 4 PQ d square? That's because the standard normal deviation is usually it's 1.96. So 1.96 approximates to 2. So if 2 times 2 or 2 to the power 2 is 4, P is your prevalence, Q is 1 minus prevalence, and D square is your precision. At your level, this is more than sufficient. But if you guys want to get into it, there is a different sample size estimation for case control, for cohorts, for RCTs, for validation studies, for one-sided hypothesis, for two-sided hypothesis. Yeah, so these are the different ways that we have, sample size estimation and calculations, and also for cluster based samples, right? So this is the thing that you guys need to have in mind. I mean, should you guys plan to be in research or work? Again, I don't have any study, but there'll be a lot of researchers who have studies going on in their place. And if you want to do some assistantship, usually this is the thing that we do. You need to have a work plan. You have some timelines. You understand the logistics, what time you travel, what time you reach the community. You need to understand how much you can spend. You will develop instruments, and again, developing instruments in itself is a 5 to 6 hour lecture. I will not get into it, but then measurement is a function of validation, reliability. So you need to have a lot of thought and care taken when you build questionnaires. And then drawing a sample of household, training manual, primarily because you need to ensure that all the people in your team are doing the same thing that you want to do. If there is any deviation, it's going to affect your research and the final estimate. You could do some pilot tests initially to be sure that, hey, everything is working fine. Sample size formula, again, I don't want to get into it. And this is something on the project management, and I'll be closing here. So in the entire process, you may wonder, hey, research appears too much. Is it something that clinicians should do? In India, unfortunately, it's not a great focus. But if you ask in the entire interest on how Western countries have been able to be better when it comes to making the Harrisons and the big Davidsons and the big Hutchinsons and the big manuals and the big, you have all the surgeries, books, all are foreign authors. It's great to say that yes, foreign authors are good, only primarily because if you see most of the references, there is evidence in it. There is an RCT in it. There is a screening validation test in it. There is a cohort study in it. There is a case control study in it from an hospital based study. There is an insurance based, modeling in it. So that is a difference. So my question to it, why can't India have its own Harrisons and Davidsons? Absolutely possible. But the problem is, yes, we are so lazy. We feel that, yes, as I told earlier, we probably think we are probably the top most in the world. We have probably cracked the best things in the world, so on and so forth. Now, why I'm saying all this in project management, you guys may question. I'm not going to take more time. But should you wish to be a good researcher, these are the most important steps that you have to get into. It's not going to be a walk in the park. Grant writing has its own set of skill sets and things that you need to develop. The entire research process that I mentioned earlier has to be documented. You need to identify good donors. Donors giving you money as a researcher, it's a highly competitive process. It's like, how you crack your NEET, everything. So you need to get money. Usually you need to work under some academia to get grants and get the money funded in. That's first. Next comes, you need to also be aware of administrative and financial aspects, primarily as I told, planning your team, planning your money, planning how you spend it, ensuring that your work is also translating into meaningful data, so on and so forth. Approvals, it's not something that, as I told, you can't just have a protocol and just go for it. You need to have an ethical approval. At times you may have a scientific approval, primarily if it is something that happens at a very new innovative space. So may have DBT, DST approvals, health minister screening community approvals, ICMR approvals, and some state governments also have them. Then you have a data collection plan, primarily to understand when you're going to start, when you're going to end, how many people you're going to hire, how many people are going to go where, who will go where, how long they're going to spend time, what are your target samples, blah, 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 blah. Everything that I discussed a little while earlier. Your M&E, your monitoring evaluation, is essentially to understand whether all the processes that you thought of is actually happening rigorously. You could expect like 5% deviation, but anything beyond 10-20% deviation, you're not a good researcher. So that you need to be very, very, very critical about it. Evaluation, as I told a couple of slides earlier, have you been able to do good research, whether it is able to translate into policy? Are you doing meaningful work so that you are able to affect the lives of the people thanks to the intervention or things that you have studied? Yes, you could have to evaluate yourself. And then comes a data management plan. Yes, we speak about data, 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 but is that data correct? Is the data clean? Is the data complete coverage? Is the data having any nuisance values, nonsense values, missing values, so on and so forth? And that's where you use all these statistical tools and packages like SPSS, SAS, Stata, R, Python, and so on and so forth. I don't believe in AI for doing all this data management. You can use AI for analysis for sure, not for data management. Data management is still something that humans should do. For analysis, you could do some basic elements in all these softwares, again, for which you will have to learn coding. If you plan to use AI tools, etc., at least learn the fundamentals of it. At least you need to know what needs to go in so that you will be able to get the desired output. If you don't know what is required for a chi-square and you just blindly use a data set and put it to an AI model and ask conduct a chi-square, it will not be able to do. You need to know what variables need to be there, what property of the variables need to be there, and basis which the AI model can then deliver. So for analysis, I'm fine, but yet still there are some issues with few large language models. I wouldn't say that AI is still there, but if people are interested, I'm more than happy to guide on what are the issues there. For visualization, you have tools like Power BI, you have tools like Tableau, you have tools like Google Lookup Studio. You also have the simple basic, Excel and PowerPoint slides. You could also work with the, simple visualization from Stata, SAS, and R, ggplot as well. Again, all this is a function of how much you want to learn. If you don't want to learn, yes, you could skip completely, but you could probably hire someone who knows it. That's completely your choice. Finally comes the report writing, wherein doing all this, you then translate all your data findings into a meaningful interpretable data. Simple line, you can't write to a policy maker that this is the odds of a disease, this is the odds of a risk factor, the relative risk of air pollution is so much. They will not understand. They may be IAS officer, they may be ministers, etc., etc. They will not understand. You tell prevalence, incidence density, blah 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 blah, and all this necessary terms, they will not understand. You have to tell how you will be able to explain your research to a LKG UKG student is the way you have to explain to a maybe a program leader or a health minister or a policy IAS officer, secretary, etc., etc. Right? So that is your report writing. It could also be in publications. It could also be in your, let's say, you submit some conferences, abstracts, so on and so forth. And then also after your grant ends, that's also a very big headache. You need to give all the statement of expenses. You need to show how much you have promised, how much you have committed, whether you are being able to do justice to it, and that then labels you as a good or a bad researcher. So yes, welcome to the world of research, and happy to take any questions, unless you guys are interested to go watch IPL.
Please drop in your questions on the chat box so we can go through it. So we have one question.
I'm just looking at it. I'm planning to conduct an RCT, but it would only include sample from an institution. So would it be meaningful? Yes, absolutely. But then you need to have a protocol. In that protocol, you need to mention what is your problem statement, and in that problem statement, how your intervention is going to work. And then you need to have an RCT, intervention control group. So you will have the entire research methodology process defined, a sample size estimation, and then you need to have a good ethical approval for it. The problem here, however, though, is I don't know whether you're going to do it alone or you're going to hire a team to do it. But if you have a good ethical approval and also budget to conduct this kind of a study, then the next step would be, you get all the necessary approvals and you can carry on with it. So it's not a problem about doing it within an institution. It's about the target population you want to do. So I'll give it thought. So if let's say you're doing a study for heart attack, I don't see a problem whether a heart attack in PGI Chandigarh would be different from AIMS Delhi. It's going to be the same, right? So if your RCT is for heart attack, you can as well do it in PGI Chandigarh and do it in a sample of 50 people. That should not be a problem. But the question is your sample size, whether you will be able to get so many people in your institution. That's the question. Anybody else? How did you arrive at this 30 people around? Did you do a sample size estimation? With due respect to all clinicians, most clinicians don't understand research in India, so I'm so sorry. Uh, if I were you, I would look into previous research. I will try to understand what is the intervention I'm trying to study and what is the effect size I'm planning to achieve. By effect size, I mean what is the difference in change I'm anticipating from intervention and control. Basis the effect size, I will then arrive at a sample size. But if you don't have any effect size in mind, then uh, arriving at 30, again, it is all a function of what is your target intervention. So I may not be able to comment much here. But yeah, you could feel free to reach out. I am happy to guide you guys. So this is my email. I don't think people will unmute. Probably people are watching IPL. I contacted a professor of ours and he gave a topic to research in the use of mobile phones and effect on sleep-wake cycle of MBBS students and suggested that questionnaire should be circulated on Google Forms. Is it something worth spending my time on? Okay, so my question to you is, how many students in your college have or are they tech savvy to fill Google Forms? Number one. Number two, let's say you have a target sample of 500, and in that 500, you have everyone's email. You will send it out to them. So, what is the anticipated non response rate? I don't know. Only you will know. The second thing is, it's always possible that maybe, let's say you may have two, three responses from one email. I mean, you may have duplicates. I'll tell you why. Let's say I share a room with my roommate, and then I have three, four people in the same room. First, I submitted a question from a same email ID. Second questionnaire also from the same email ID. Third also from the same email ID. Then how will you identify that? Last but not the least, my concern would be, because you are saying in MBBS students, your entire um, target population is clearly defined. So I don't see it as a vague target population. It's definitely a good question to do. But my concern would be on how you are measuring your sleep wake cycle. So do you have a validated questionnaire? Are you going to put that validated questionnaire in it? And then are you also going to give some small SOP so that the students will understand what to respond where? If you're not able to explain your questions, then one is their issue of non-response and duplication, but one is they may not understand what you're going to question. So that is the only issue I find in Google Forms, but otherwise it's worthy to try. And if you guys also plan to publish, please, please, please have an ethical approval. Just don't go for the sake of publishing and put in some XYZ journal and say that, hey, I have 10 publications. Please don't do that. I'm sure most of your institutions will have an institute ethical committee. Make a very simple protocol, submit it, get an ethical approval, and then you could also, even if you're not going to go with the high impact journals like Lancet and all, that's all too hi-fi. Forget it. Simple basic one to Indian Journal of Community Medicine, Indian Journal of Public Health, or Indian Journal of Radiology, Anesthesiology, Surgery, or even some international journals of surgery or medicine you could try. But these days, any publication without ethical approval is not correct. Result writing after data collection. I think I need to have a separate session on that. So there are a lot of things which I probably didn't get into. One of which is definitely the data analysis and how to translate the data into meaningful tables and representation. So that is definitely an maybe an hour or 2 hour long thing wherein you start with descriptives, then you go into inferential statistics, then you go into differential statistics, then you go into visualizations, then you go into interpretation. That is a broad process. In result writing, if your protocol has been done very well, right? If you have got a very good protocol, your introduction is nothing but a super copy paste. Your methods is a copy paste. All you need to work is only your results with good tables and figures. And then you need to write your interpretation in your discussion session with, references to what previous work has happened, what were your studies, limitations and strengths. How do you think your research findings would be used by policymakers, so on and so forth. But yeah, again, this is something that, Dattatreya and team can tell me if you guys. I don't have time, maybe in the next 1 month, but I'll be happy to cover up some topics here and there.
So, as we come to the end of today's session, I want to sincerely thank Dr. Girdhara Gopal for sharing his valuable insights with us. His thoughts on planning research projects gave us a clear understanding, and we look forward to learning more and putting these ideas into practice in future. I also want to thank each one of you for your active participation. Research is a continuous journey. In the coming session, we have an exciting lineup of topics and speakers who will further enhance our understanding of basis of research biostatics to ethical approval and publication. I encourage you all to stay engaged, ask questions, and make the most of this learning experience. Once again, thank you for being a part of this session. I look forward to seeing you in the upcoming discussion. Have a good night.